So, just talking a little bit about the expected new ownership takeover of the Claremore Indian Hospital right down the road from me over here. Um, what is your role in this overall process?
Well, currently I'm the CEO and Executive Director of Cherokee Nation Health Services. And so it's my role to oversee the entirety of the Cherokee Nation Health system or health program.
And so this is a big step taking over this hospital, is it not?
It is. This is an assumption that has been in long time coming. Um, this facility has been located on our reservation for since its inception, and it's been ran by the Indian Health Service. It's the last piece of federal ran healthcare on the reservation, actually. So the assumption of this facility and this healthcare facility and program will unite our healthcare along our whole reservation, and we're very excited about that. The patients and the community here have had to navigate two different health systems, especially the Cherokee citizens and those that use our healthcare system located in other areas on the reservation. They have to go through two different health systems. They have to go through this Claremore Indian Health Service system, and then when they're denied services, they're eligible to come to us. So this is going to make things a lot easier for the patients too, to have one health system to navigate instead of two.
Sounds like it's going to streamline everything.
It's definitely going to streamline everything. And the other issue here that is that the federal government has not been able to uphold its obligation to American Indian and Alaskan Natives. They are way behind as far as funding goes to keep the facilities running and provide the services. Cherokee Nation is going to bring into this area and into this community resources that will bring to bear. Our chief has already made an announcement that he's going to take before tribal council to um, proposed spending $255 million on a new facility here in Claremore. That alone, those resources are something the federal government cannot do by their own numbers, by their own documents that we've been able to get through this process of assumption. We've found that they are over $100 million behind in program preventative maintenance and upgrades to this facility. And so that shows itself that there's been a lack of attention and a lack of resources in this area. It's not the fault of this workforce. It's not the fault of this community. It's the fault of the IHS not allocating the resources appropriately to this location. And so as a result, we finally decided, or I won't say finally decided, we've been looking at it for a number of years, and Chief Hoskin has made the commitment that it's time to step up and take care of the people in this area. And so that's what we're doing. We're making the assumption, and we're going to pour the resources and the all the things that we need to do to increase and improve this healthcare system, to bring it up to our standards, to bring it to bear to this community so that they have the same availability and access to healthcare that the rest of the communities across the Cherokee Nation have.
Thank you, Dr. Jones. Well said. Now I know the answer to this might be a little obvious, this question, but why choose to build a new building and step away from the old one?
This building was built, I think, in the late 70s or mid 70s, somewhere around that line. It has not been kept up to standards. There, as I said, over $100 million worth of upkeep and repairs that are needed into this facility. And once you do that, you still have an old facility. It's not set up to deliver healthcare in today's times. We have a different level and standard of healthcare than they did in the 1970s, and we want to bring this community up to that level. Frankly, we don't want to put good money after bad.
Absolutely. And of course, when we scroll online under our story, under the Cherokee Nation's post, there's a lot of questions right now. One of those is, what services will remain in the meantime? As far as I've been informed, only the overnight care is what's being eliminated. Is that correct?
That is true. The inpatient care is being eliminated, and there's reasons for that. Financial reasons. Again, it comes down to funding, and currently the Indian Health Service has failed to increase the funding that's needed for this facility. As a result, this facility only has a daily census average of less than four. Around 3.2 is the average census here. The ER is used quite frequently, so that operation will stay in functioning after the assumption, and the outpatient services will all stay functioning. When we did our analysis and we looked at things across the board, only 13% of the usage of this facility is inpatient. 87% of this facility is used for outpatient and ER. So we plan on expanding and expanding on that usage and bringing more resources to bear to this community. And unfortunately, these are hard decisions. They're not decisions that we take lightly. We are working on partnerships. We have partnerships throughout northeastern Oklahoma. You can look at our track record, look at our partnership with OSU and other community hospitals around our reservation. We plan on having those partnerships in place here. So patients aren't going to be displaced. We are going to have access to care. Our goal is to keep patients close to home where their support system is, and we're going to continue that goal. We've done that throughout the reservation. We'll continue to do it here.
And will inpatient care then resume when the new building opens up in 2027?
No, we're not going to build inpatient care into that facility. We are going to plan for the future in case we want to bring that back to this community. I think that is something that we have done in all of our facilities is plan for the future so that we don't limit ourselves when we build a new facility. But in this case, that is not in the plans at this time.
Okay. Absolutely. Thank you for that answer. Another question I see around is what's the plan ahead for the employees at who are employed right now by IHS at the Claremore Hospital?
So currently, my staff is my all my executive team. We came up here Monday, and we've been meeting with the executive team here and all the department heads to let them know what the plans were and how things were moving forward. We've continued to be here throughout this week. As a matter of fact, today we're staying to meet the night shift as they come on this evening to give them every opportunity to meet with us, to ask their questions, hopefully alleviate some of the anxiety, and answer truthfully, be transparent about what this process is. This process started 8 months ago when we started negotiation and let the IHS know we were planning on assuming this facility. And through that negotiation, the IHS has come to an impasse with us. They have decided unilaterally to offer a contract for these employees to work in our system that increased our financial burden by 712%. We can't take on that burden and hope to open up and access to care like we want to here. So we've decided that we will offer employment as a Cherokee Nation employee, direct employee to this workforce. So starting on Monday, the 16th, our HR department will be on site. We'll be opening up all the jobs that we feel are needed in this area by our staffing model. And these employees are going to be the only ones that have access to those jobs. This is going to be exclusive for this workforce. And those that choose to come to work for us we're going to welcome with open arms. We want this workforce to be here. They've been taking care of this community for years. It's important that we take care of our own communities. So we are encouraging them to come to work for us. We would love for them to be able to stay a federal employee, but that's not possible under these negotiations and what IHS has put on us. So this is the alternative. And we're going to, as I said earlier, give them exclusive access to all the jobs that will be available for this new facility first. And then they can make the decision whether to stay with us or to stay with the federal government and find another federal job, unfortunately.
So, hypothetically, if all the employees at IHS wanted to work for the Cherokee Nation with this new plan ahead, there's a place for them.
There are going to be a number of job openings according to our staffing. Right now, I believe there's around 370, 380 jobs are people that are currently employed by Claremore Indian Hospital. And we anticipate around 375 to 380 jobs being available for the outpatient and ER services. I can't say that it's going to be a one-to-one, every single job is going to be available, but we are planning on trying to keep as many people employed as we possibly can.
Okay, good to hear. I'm getting near the end of my questions here, because I think we're wrapping up a lot of the concerns and some of the rumors out there. But there's been a lot of work into this. So, I mean, you have to be partly excited for what's to come, correct?
We're very excited about it, and I'm going to, our tribal council is very excited about it. Our chief and our administration is very excited about it. We deal with the patients that deal with having to navigate two health systems. And I've done that since I've been here since 2018 in this job. It's discouraging and it's frustrating. It's frustrating for us to try to help these patients, and they're frustrated because they don't understand that they're having to deal with two different health systems. So to unite this health system under one Cherokee Nation Health Services and to be able to provide the level of care and the level of services that we are accustomed to, that we expect of ourselves, and bring it to this community is very exciting for us. Our teams are very excited to be able to break down those barriers and open up access to care like it's never been open before.
Good to hear. Okay, that wraps up all my questions. Is there anything else you guys would like to talk about that I didn't mention?
Julie, is there anything else you'd like me to mention?
Well, you did talk about the average number of patients, correct? That it's under four.
Yes.
Not I can't think of anything. I think we hit on everything.
Okay. I mean, and since obviously we've had a good how long? Almost 10-minute interview on this. Would it be all right if I use the full thing to link on our YouTube page so if people can hear more of what you had to say and not just, whatever minute or two I can pull for TV? Would that be okay?
Absolutely. Yeah, absolutely. I mean, we've been transparent with this process from the beginning. And I will tell you that this negotiation with IHS has been long. Immediately last week, when we found out that we were at an impasse and they were not going to be able to negotiate with us to be able to keep federal employees employed within our organization, um, we felt like it was important to get in front of the employees, and that's why we started this Monday morning. So this has been a quick turnaround for us because we feel like this workforce is very important to us. We value this workforce. We value the work that they've done for years, and we want to make sure that we're transparent with them.
Great to hear. Oh, and I guess I just thought of another one, but if people have questions beyond what we've discussed in our interview today, where can they go to find answers?
Our team is on the ground here. We're going to be on the ground here for the weeks to come. We have someone embedded that's been embedded in this facility for the last 8 months. And right now, our whole team here is here. And again, like I said, we'll be here tonight to meet with the late shift that comes on at 7. We're also going to have our HR team here all next week. And so our doors are open. We're here to discuss. We would encourage them to discuss their options with the IHS because currently this workforce is employed by the Indian Health Service. They are not employed by us. I don't know, and I'm not an expert in their HR processes or what options are available to them, but we have encouraged them and we've asked IHS to have people on the ground here also to help this workforce navigate those difficult questions that pertain to their current employment. I don't know that that's happened yet, but that's what we've requested.